So for this video, we're going to be looking at some of the miscellaneous special tests or provocation tests for the wrist and hand. The first thing that we're going to begin with is a figure 8 measurement of the wrist and hand, which is helpful for keeping track of an objective measure of swelling or circumferential changes. So to begin with, you need to have a tape measure handy. You're going to have the individual's hand in a palm up position. Centimeters will be the side that you want on the tape. You're going to place your 0 mark on the ulnar styloid process, come across the palmar aspect of the wrist to the radial styloid process. You're going to wrap that around and up to the 5th MCP, metacarpal phalangeal joint. Come across the palmar aspect again, and then allow the tape measure across the dorsum of the hand back to your 0 point. It's where they overlap that you're going to take your measurement. So in this case, we're going to allow that to unwrap, allow our patient to relax, and we have 43.7 centimeters. We then would make a comparison left to right and assess for any asymmetry that would correlate to a specific pathology or differential diagnosis. Our second special test is specific to Tinocenovitis of the APL and EPB, otherwise known as the abductor pollicis longus or the extensor pollicis brevis. These are two tendons that are chronically involved with Tinocenovitis associated with de Quervain's syndrome, and these are associated with the anatomical snuff box at the base of the first CMC. These are going to be tested by having the individual extend their arm, taking and tucking their thumb underneath the digits, wrapping the fingers around like a fist, and then ulnar deviation. If pain were to be reproduced, we would expect it to be reproduced along those two tendons and right at the base of the first CMC through the anatomical snuff box. Go and relax. Again, Finkelstein's test. The next test is for an ulnar nerve palsy or pathology, and it's known as Froment's sign. For Froment's sign, you're going to need a piece of paper, and you're going to have the individual begin in a palm up fashion. Now for this, you're going to take your piece of paper, and you're going to bring that piece of paper in and ask the individual to bring their thumb onto it. Now normally when you pull on that piece of paper, you're not going to be able to pull it out because the individual is going to have the grip strength or the pinch strength with the thumb. In an ulnar nerve palsy or pathology, they're either going to compensate by using a flexor pollicis longus, and so you'll see the distal phalange flex to compensate, or conversely, you'll be able to pull the paper away straight out without the ability to resist. Again, Froment's sign. Finally, we want to look at a test that is more of a stress test for the TFCC, or the triangular fibrocartilage complex, which is found on the more ulnar side of the wrist and hand. For this assessment, you need to bring the individual into slight flexion of the shoulder. We're going to place their elbow on our distal thigh and knee. At this point, we're going to bring them into a neutral position. We're going to grasp the wrist and hand by shaking their hand, ulnarly deviating them to end range, and then once there, pronating and supinating while maintaining that ulnar deviation. A positive for the ulnar carpal stress test would be either a click indicating involvement of the TFCC and or the reproduction of the patient's complaint of pain, the comparable sign. 4 special tests that we use at the wrist and hand. Have a go with a peer or colleague. Let me know if there's any questions.